Here you can see the Celon method for the volume reduction of hyperplastic tonsils using the Celon Pro Sleep applicator. With this method, the tonsils can be reduced in size by between 30 and 40%. Where children between at least 4 and 12 years of age are concerned, the operation should be performed using intubation anesthesia. Anesthesia by means of a laryngeal mask is also possible. If chronically recurring tonsillitis is involved, it's advisable to avoid thermotherapeutic treatment. This also applies to the so-called kissing tonsils in small children. Instead of this, the Celon Pro Cut system is recommended for reducing tonsil size in such patients. A perioperative antibiotic prophylaxis is recommended, for example with cephalosporin antibiotic. The extent of coagulation induced depends on the power setting on the control unit. A setting of 7 watts is recommended for achieving lesions in enlarged palatine tonsils. The lower the power setting, the longer the application time and the greater the extent of coagulation. The applicator is inserted into the tonsils until the insulating tube of the probe touches the tissue. After positioning the probe, the power supply is activated by pressing the foot switch. The status of coagulation can be controlled via the acoustic signal. The increasing pitch of the signal indicates the progress of coagulation and the increasing tissue impedance. The power output is controlled automatically. Completion of the coagulation process is signaled by a high-pitched interval sound. The power supply is reduced automatically. Overdose effects are excluded. The individual points of insertion should be aligned at a distance of 10 millimeters to each other. The absolute number of insertions depends on the size of the tonsils. In general, 4 to 5 punctures are sufficient. Take care not to penetrate the underlying tonsil capsule where narrow tonsils are concerned. The coagulation process should not be located in the immediate vicinity of the tonsil bed. It may be possible to extend the distance between coagulation and the critical structures by pulling the tonsils towards the median plane. The applications only need a few seconds for each lesion, meaning that the intervention itself only lasts about 10 minutes. Bleeding is rare and ceases spontaneously as a rule. An adenectomy, which may be required, can usually be performed without risk during the same treatment session. The coagulated tissue is eliminated by the body's own resorption process within the next 2 to 3 weeks, leading to reduction in size of the tonsils treated. If necessary, we recommend post-operative pain treatment for children using ibuprofen or paracetamol. For adults, we recommend the administration of diclofenac. Children should be kept under post-operative observation for at least 6 to 8 hours because of the danger of swellings. Here you can see the result of the treatment 3 weeks after the application. The situation beforehand is shown for comparison. The treatment may be repeated without problems 6 weeks later if required. We wish you much success using the Celon method. For further information, please contact Celon directly or visit our internet site at www.celon.com.